Hi, welcome to this unique haircare initiative by IFCA. Mona Sharma, and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle age problem when you used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in a daily work life, we are now seeing hair problems occurring at a younger age. It is not uncommon now to see 25, 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today we have with us Dr. Sandeep Bullous, is a well-known dermatologist and has been practicing medicine for over many years now. His MBBS MD then specializes in dermatology, cosmetology, and trichology. He currently practicing as a consultant dermatologist at his own clinic, Saanivis Laser Skin and Hair Clinic, Hyderabad. Dr. Sandeep has dedicated his career to diagnosing and treating a wide range of skin and hair conditions while providing personalized hair care services to his patient. He takes time to listen to his patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Doctor has is also aware of the need for the patient education about hair and skincare and spend a lot of time in giving talks at various platforms across the country. Thank you so much, Doctor, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to this YouTube live show.
Sure, ma'am. Most welcome.
डॉक्टर हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया तो टुडे वी आर गोइंग टू टॉक अबाउट हेयर केयरिंग करंट सिनेरियो तो जब भी हम हेयर केयरिंग करंट सिनेरियो के बारे में बात करते हैं तो वेरी कॉमन प्रॉब्लम जो हम सब फेस करते हैं irrespective of gender and age is hair loss.
Mm-hmm.
So can you please
Mm-hmm.
enlighten us today with your profound experience, like what's normal and when to be concerned for?
Hair loss, hair thinning. They're two different entities.
Mm-hmm.
Okay. What you mean by hair loss is a visible loss.
Mm-hmm.
When you shower, when you brush your hair, when you put some oil on your scalp, that's called hair loss.
Mm-hmm.
And hair thinning is invisible loss.
Oh.
What do you mean invisible loss? Where we can't appreciate our peaks or our colleagues who have
Mm-hmm.
noticed our long term, na, they will say you got bald. That is called
Mm-hmm.
Okay, that is called hair loss, permanent hair loss. Okay, hair
Mm-hmm.
fall is different from hair loss.
Mm-hmm.
Hair fall, how many
Mm-hmm.
strands you can accept as a normal fall is
Mm-hmm.
normal. It's not hair fall. Less than
Mm-hmm.
80 per day randomly.
Okay.
Okay, that's not
Mhm.
considered as hair fall.
Oh.
Okay,
Mhm.
again,
Mhm.
hair fall more than 100
Mhm.
for less than 3 months also it's not considered as hair fall.
Mhm.
Okay, stress or fever, anything 3 to 4 months back, yeah, it
Mhm.
reflects as hair fall after 3 to 4 months.
Mhm.
Okay, that is a
Mhm.
recoverable loss. Okay,
Okay.
we can see that hair fall in a post fever, post typhoid, post COVID,
Mhm.
post
Mhm.
delivery, post cancer
Mhm.
treatment. They get bald now. Again, they regain that hair. Okay, visible loss more than 100 for less than 3 to 4 months is also normal.
Okay.
Clients who are like a vitamin deficient, clients who got
Mhm.
chronic stress, for them,
Mhm.
like a hair fall gets won't get control, it goes on moving after three
Mhm.
or 4 months. That
Mhm.
leads to hair thinning.
Mhm.
Okay, that's a very thin, like a line of differentiation between fall and hair thinning area.
Mhm.
So
Mhm.
clients who got visible loss more than
Mhm.
100 for more than 3 months, that's the thing to worry. They need to consult a doctor.
Okay.
Not like a fall within weeks. Again, there's no human being without fever or stress.
Mhm.
Okay, not of going to a doctor and getting treated. You can wait
Mhm.
for a while. Encourage all common knowledge like fruits, vegetables, dry fruits, and a bit of healthy lifestyle that help in regaining the visible loss.
Mhm.
Okay, once then again to thinning of hair, that is
Mhm.
baldness.
Mhm.
Okay, so we are seeing a bit of aging early area. There's no specific reason. By
Okay.
10 to 12, 13 years only, we start seeing baldness. And
Mhm.
that criteria, again, it's individualized. One
Mhm.
client may come on 18 years, one client 20, 25, 30, like that.
Mhm.
Okay. So
Mhm.
whenever one client feel thinning of hair,
Mhm.
his journey starts from there in the form of making hair existing a thick and strong.
Okay.
Got it? Past is past.
Mhm.
Once bald, bald. no doctor, no medicines, no surgeries. I mean, if liver for transplantation, PRPs may help in like existing it to become strong and healthy, not like a hair in bald patch. Got it? So, like we see so many things, but only limited things are approved for making existing a strong and hair, like minoxidil, finasteride. Again, clients with hormonal issues, oral contraceptive pills, then supplements. Okay, then capixil. Okay, then dutasteride. They're all things which are FD approved for treating baldness. And dosage, duration, it's all individualized. And also like depending upon the like marital status and also other health issues. Yeah. Okay, so once you start journey for hair now, making that strong and healthy, so we have to use it until we desire in our life, like 1 year, 10 years, even 100 years. It's all thing. Maintenance is the thing is a key factor for protecting hair. Not like using a month and stopping it. We won't achieve any results.
Okay.
Okay, once you start journey, you have to use it for long term.
Mhm.
Got it. So these things, like again with like simple lifestyle of not using hard water, then having protein rich diet, avoiding pollution, cigarette smoking, okay, extra calorie dinners. This also slows down the like a process of balding. Okay, then coming to myths about balding. Okay, we like see that like my father got hair, I'm bald. Okay, my father is bald, I got hair. He may got the gene, she may got the gene from maternal or paternal uncle, grandfather, great grandfather. This like instead of searching a clue for getting baldness, we have to address the baldness. Okay. Then second myth is visible loss is permanent loss. No, visible loss is temporary loss. Third thing, roller. I use roller, you'll get hair. No. Here, na, for the sake of getting hair, we are damaging the skin. Means punishing skin without like this. It's not a culprit, but punishing it. Fourth myth is hair oil. Okay, hair oil. You apply hair oil, you'll get hair. That's a billion market nowadays. Okay, hair oil won't help in hair growth or hair fall, but applying hair oil and roaming out may trick dandruff nowadays. So you can apply hair oil as a like a conditioner, not like for hair growth.
Okay.
Then again, next myth is like a tonsure, complete tonsure. Okay, if I tonsure my hair, I can protect it. No, we are getting bald subconsciously. Hairline starts receding back. Got it. And again, medicines, PRPs will help in hair in bald patch. No, even if put 1 crore, we can't grow back hair if it is bald. Okay. Then thing is transplantation. Okay, coming to transplantation, like previously we used to do like strip method. Now we entered into extraction method. Okay. Previously we used to with general anesthesia. Now it become local anesthesia. Previously it's like hospitalized. Now it's like clinical based. Things are becoming much more refined and downtime has been reduced drastically. Okay. So who are eligible for a transplantation? Normal healthy clients with good amount of donor area and minimum amount of recipient area. Okay.
Okay.
That is reverse means chance of failure will be high. Okay. No cardiac issues, not obese. Anesthesia should be matching. Okay. No like other renal issues. Other chance of low immunity infection, HIV. This is a proper hepatitis C infections. We shouldn't encourage the clients for transplantation. Okay. Normal healthy clients with good amount of donor area and bald. Okay.
Okay.
We are extracting hair from the back and implanting into bald patch. That starts growing within 3 months. And by 1 year, we can see the results.
Oh.
Not like a month. Okay. Again, myths about transplantation. It's like that surgery may like a cause like a death. That's like a death related hair transplantation. We don't know about the health status, obese, heart failure kinds. Okay, they are the clients who face the death, not with everyone. Okay, that means we seen one in 10 or 100 crores population. Okay, so death is usually like due to other health issues, not due to transplantation. Okay. Next, 100% success rate, no. Okay. Depending upon the age, other health issues, success rate depends here. Okay. As young we are, has much good results. Okay. Reverse also. Donor area should be strong. If it is thin, poor results. Okay. And again, who is doing it? Okay. Under whose supervision is doing it? Before transplantation, medicines. After transplantation, medicines.
Mhm.
Okay, again,
Mhm.
like post transplantation procedures that also
Mhm.
impact on the outcome of a procedure. Okay,
Mhm.
when to start
Mhm.
minoxidil, like along with minoxidil, what are the supplements? When to
Mhm.
start finasteride, when to stop finasteride. Okay, when
Mhm.
to start TRP, whom have to go for
Mhm.
transplant. It's
Mhm.
like art rather than a like surgery.
Mhm.
Okay, choosing a
Mhm.
perfect client gives like a dramatic results. Okay,
Mhm.
that's not a piece of cake for everyone actually. Hair transplantation.
Mhm.
Okay, and post transplantation, like as I said earlier, na,
Mhm.
like a minimum prescription and
Mhm.
like following doctor frequently. Okay,
Mhm.
even virtually will help. Okay,
Mhm.
that help like existing hair to become strong and healthy.
Mhm.
Okay. Again, myth about transplantation, that hair will be like we lost that hair. Okay,
Mhm.
transplantation hair will stay for 1 to 2 decades here
Mhm.
easily. Okay, post transplantation, we have to take care of the like existing hair, not the transplanted hair.
Mhm.
Okay, like we can shave it off, we can hair dye, we can we can go for straightening. Okay, as we treat our
Mhm.
like normal hair, na, we can treat transplanted hair. Okay, that is
Mhm.
permanent. What we mean
Mhm.
permanent is long term.
Mhm.
Okay, and
Mhm.
next thing is cosmetics, hair cosmetics. There are
Mhm.
different shampoos. They ask which shampoo I need to use. Okay,
Mhm.
so if it is not a professional one, all shampoos are same.
Okay.
Shampoos should be minimum lather. Like lather, if it is lather, it is worst. It damages the hair
Mhm.
condition and oiliness on face and the scalp.
Mhm.
Then again, medical shampoos like ketoconazole, then
Mhm.
climazole, then
Mhm.
these shampoos like help in controlling dandruff on the scalp.
Mhm.
Then again, one more myth, like dandruff is causing baldness. No, dandruff won't cause baldness.
Mhm.
Psoriasis won't cause baldness. Okay,
Mhm.
it's the
Mhm.
only myth.
Mhm.
Then coming to conditioners,
Mhm.
dimethicone conditioner is the best one to use.
Okay.
Okay, need to be used without any shampooing. Okay, as everyone
Mhm.
knows.
Mhm.
Before after a conditioner, you should use only water.
Mhm.
And coming to supplements we can only advise like 3 to 4 months in a female, not more than that. Again,
Mhm.
if you use more than 3 to 4 months now, that causes facial hair to go strong and health. So that's an awkward
Mhm.
situation for the female. So supplements is to restrict until hair fall gets controlled at
Mhm.
not more than one cycle. That is 3 to 4 months.
Mhm.
For males, is not a concern.
Okay.
Clear na? Then conditioner, shampooing, and what we shouldn't do, using hard
Mhm.
water,
Mhm.
shaving off the hair for the sake of protection,
Mhm.
using excessive lather shampoos.
Mhm.
Okay, these are all the things. Okay, pollution, smoking.
Mhm. Yeah.
Okay, okay.
Mhm.
Then extensions that all cause like loss of existing hair area.
Mhm. Mhm.
Any
Yeah.
questions?
Mhm. Yeah.
Any?
So, Doctor, like
Uh,
you have covered almost everything.
yes.
But nowadays, like we all live a lifestyle which is like so busy and working late and eating anything which is available. So, can a person lifestyle play a role in hair loss or hair health?
So, that's like a simple general knowledge thing. Yeah, if we ask ourselves, okay,
Mm-hmm.
as we get up, we know the things. Okay, what to
Mm-hmm.
eat, what not to eat.
Mm-hmm.
But the trend has changed a lot. Okay,
Mm-hmm.
fruits becoming much more costly when compared to junk.
Mm-hmm.
Okay, they're driving towards that point. Yeah, actually, subconsciously. If we take a
Mm-hmm.
pizza, that much cheap when compared to kg of apples.
Mm-hmm.
Okay, we take junk subconsciously. Okay, and with the junk, we are not building any nutrition. We are only filling our like satiety center, fulfilling our diet.
Mm-hmm.
So I tell my clients, eat at least one fruit and one seasonal vegetable.
Mm-hmm.
Okay, you choose your fruit and vegetable at least. Okay,
Mm-hmm.
not of taking cages. Okay, and try to avoid junk at least in the evening.
Okay. Mm-hmm.
Okay, that's a waste calories that will build hormones that will
Mm-hmm.
cause health. At least minimum days in a week, 1 2 days for socialization. Okay.
Hmm. Okay.
Okay. Yeah.
Hmm. Yeah. That's interesting, doctor. So, doctor, you said so many causes and reasons are there to have a hair loss. So, can you please enlighten us, like, about the medical treatment options available for hair loss, like surgical, non-surgical, and
Uh,
apart from oral and topical, what all treatment options are available?
So if we coming to like a topical na,
Mm-hmm.
minoxidil 2%, 5% is FDA
Mm-hmm.
approved.
Mm-hmm.
10%, 12.5% not FDA approved.
Mm-hmm.
2% usually advised for females, 5% for males.
Mm-hmm.
You can go 2% even for males also, but it's not sufficient.
Mm-hmm.
Okay, and 10%, 12.5% that may cause like impact on the heart. We shouldn't use it or we shouldn't advise it.
Okay.
Okay, that may
Mm-hmm.
cause like irregular heartbeats, palpitations. We should
Mm-hmm.
stay away from 10 and 12%. Absolutely, that's a
Mm-hmm.
mother molecule. Then
Mm-hmm.
minoxidil helps in hair thickening, not
Mm-hmm.
for controlling hair fall. So
Okay.
nowadays, protein serums like Capixil,
Mm-hmm.
Redinsil, okay,
Mm-hmm. Mm-hmm.
Procapnil, okay, and the topical finasteride also like available. Okay,
Mm-hmm.
so many
Mm-hmm.
companies are launching. Okay,
Mm-hmm.
we can combine them to control visible loss.
Okay.
And minoxidil should be used for like entire life. Okay, but
Mm-hmm.
Capixil can be used once in a while and you can stop it.
Okay.
Okay, and these are the things FDA approved for topical, not like hair oils.
Okay.
And then oral things, if you take now, it's like for males, finasteride 1 mg approved
Mm-hmm.
and females 5 mg approved.
Okay.
Okay, so 1 mg, like how long? Okay, I
Mm-hmm.
tell my clients until you get married. Okay,
Okay.
there is no enough studies on married couple. Why
Uh-huh.
you should take a tablet which is like acting on hormones? Not
Mm-hmm.
required. Okay,
Mm-hmm.
cosmetic things shouldn't be converted into health issues.
Health issues, yeah.
Okay, for females, na 5 mg, we have to cross check the testosterone. Then
Mm-hmm.
we have to do that test like a finasteride.
Mm-hmm.
Okay. Now we are much more advanced in treating hair loss clients when compared to Western countries here. They
Mm-hmm.
do now. If you go for hair fall, they'll do a biopsy. They
Mm-hmm.
say that it's pattern loss, irrespective of checking hormones, marital status, and like pregnancy status. They're starting finasteride 5 mg for females. That cause hirsutism means unwanted hair on the face. Okay, and they can't have that access to the doctor like we have it in India. Okay, they can't again go to the doctor. that's that's a psychological thing, the stress. Okay, change of place, change of climate, a change of food will cause hair loss, and we panic and go to a doctor over there. They need to instead of like showing the supremacy, they're doing babs and giving finasteride. In India, which we are much more safe. Then coming to next oral tablets now, the supplements. That's the previously I told. Biotin, lysine, cysteine. We require 30 odd vitamins for hair, not only biotin. Okay, it's called vitamin H. It's not true for hair loss. So plain biotin gummies won't help for hair loss. It's only psychological myth. We have to combine vitamins, multivitamins. Okay, and if you are anemic iron deficiency, if you are riboflavin deficiency, that one, we have to like address all the things. Vitamin D deficiency,
Okay.
supplements internally depending upon the things.
Hmm.
Separate hair vitamins, there are no separate hair vitamins. The combinations of multivitamins. Okay. Then coming to hormonal issues, we have to go in PCOS in females. Okay. There are
Hmm.
combined contraceptive pills. Okay.
Hmm.
Then spironolactone. Okay.
Hmm.
Again, their side effects is visible hair on the face. It's tism.
Yeah.
Okay. There should be a line of differentiation where we should stop internal medication for females.
Hmm.
And oral minoxidil is also available. Depending
Hmm.
upon the like health issues, we advise dose according to it.
Okay. Okay.
Okay.
Hmm.
We'll wind up for 20 minutes now.
Yeah,
Yeah.
yeah. We'll do it in
Yes.
we'll cover questions, and even our live audience is asking
Sure.
questions. Let's cover all of them.
Sure. Sure.
Doctor, like when we are stressed out, uh, our like there is a gharilu nuska which is prescribed by all the mothers, like apply oil, and they also say that how much uh, more you apply, the stronger and thicker your hair will be. So, what do you think? Like, what's the fact behind it? Oiling hair is more or a
So like our parents, our grandparents, their
man.
like environment, their era, their food habits are different.
Mm-hmm.
Okay, our food habits, our generation, okay, our lifestyle is different.
Mm-hmm.
Okay, hair
Mm-hmm.
oil can't penetrate into the hair. It's a
Okay.
myth.
Mm-hmm.
Okay,
Okay.
applying
Mm-hmm.
hair oil with fingertips now that cause
Mm-hmm.
massaging of the scalp, that
Mm-hmm.
cause increased blood flow to the scalp.
Mm-hmm.
Okay, previously due to that effect, hair should have like increase in length and density.
Okay.
Nowadays, if you apply hair oil and go out now, that will attract dust
Mm-hmm.
and pollution.
Mm-hmm.
Okay, reverse it causes dandruff, reverse it causes
Mm-hmm.
itching, and
Mm-hmm.
reverse it causes like hair loss. So
Okay.
never apply hair oil to the
Mm-hmm.
scalp after head bath. You can apply to length of the hair; it's a dead tissue. Before
Okay.
after, it's not a point to concern.
Mm-hmm. Okay. So let's take some live audience question. The first question is from our audience is Doctor, you said that hot water से बाल झड़ जाते हैं. So my question is, after using hard water for some years, those hair will come back or not?
So hard water means salts in the water, yeah.
Mm-hmm.
So like that causes sedimentation on the scalp. Okay,
Mm-hmm.
hard
Mm-hmm.
water for weeks or days it's okay. Months and
Mm-hmm.
years it causes permanent thinning of scalp. No,
Okay.
you won't get hair in one like long term usage of hard water. No.
No. Mm-hmm. So people should take care of water part
Yeah,
also.
that's the main thing.
Yeah, yeah. That's interesting. Another question from a viewer is, Hi doctor, I'm also from Hyderabad. I want your appointment. I'm diabetic and I recently added insulin in my regimen. And since I started using it, I'm having a very heavy hair loss. Can you please help me why I'm happy having it and what are the treatments for me?
Okay, so like pre-diabetic and starting some medicines, body will take some time to rectify its loss. So once we
Mm-hmm.
start insulin, after some weeks, 10 to 12 weeks, we start seeing that hair fall.
Mm-hmm.
Okay, one good thing is that's recoverable loss.
Mm-hmm.
Okay, we can have some biotin 10 mg supplementation, any good brand like Ipca Siva. Okay,
Mm-hmm.
with iron in it.
Mm-hmm.
Once daily after breakfast, we can try it for 1 month or 45 days. Still, if
Mm-hmm.
there is no improvement, then you can consult me. Not an issue.
Okay. Okay. So doctor's clinic name is Saanivis Laser Skin and Hair Clinic. So you can always Google and find him and get connected with him for an appointment. Uh, One more question from our viewer is, Doctor, my daughter is 12 years old and she have a lot of white hair at such a young age. We applied all remedies at home, but it's not helping her. Is there any solution for this? Can we stop it and reverse these gray hair?
So gray hair is like so many reasons for gray hair. Like
Mm-hmm.
if you take 100 clients now, 90% of clients there'll be no reason, idiopathic.
Mm-hmm.
10% will have reasons like if a father or mother having gray hair, early graying of hair, it will impact on their next generation.
Mm-hmm.
Okay, that is called genetic.
Okay.
Next thing is vitamin D deficiency. Next thing is
Mm-hmm.
mother having thyroid with a chance of getting kids also a bit there. So
Mm-hmm.
you have to cross check their thyroid status.
Mm-hmm.
Okay, check serum ferritin, iron, thyroid, and vitamin D levels.
Okay.
If they are normal, irregular
Mm-hmm.
night sleep also causes early graying of hair. Irregular night sleep.
Mm-hmm.
The black pigment in the brain, melatonin, it will regenerate in okay like a deep sleep. There's no
Mm-hmm.
deep sleep now. That pigment we won't get it. Okay,
Mm-hmm.
it reflects on graying of hair. So night regular sleep much more important for protecting remaining. Okay, there are so many myths again. Men matters. There are so many cosmetic things which say that we'll revert gray hair. Okay,
Mm-hmm.
in that case, they are only manufacturing hair dyes. What's the reason if they're
Mm-hmm.
reverting gray hair? Okay, they're just fooling us. Okay,
Mm-hmm.
once
Mm-hmm.
gray, gray.
Mm-hmm.
Okay, we can
Okay.
only slow it down graying. We can't stop it actually. Okay, if there is any deficiencies, lack of vitamin D, or excessive
Mm-hmm.
exposure to sun also will cause graying of hair. So
Okay.
cross check iron, thyroid, and vitamin D. If they're too low, pediatrician will help. If they're also normal, then they can consult a dermatologist for topical
Mm-hmm.
treatments. It's 100% safe for 12 years kids, no problem.
Okay, that's interesting. I'll quickly take one last question from our audience. Hi, doctor. I got recently detected with androgenic alopecia, and I was having a lot of hair loss, and my friend asked me to go for the test, and I found I'm having androgenic alopecia. Is there any treatment for me? I'm getting slow by slow. I think I'll get bald.
So, like again, you start wherever you are. You can start depending. She's a male or female.
Nah, he's a male.
Yeah, okay. So start using like a 5% minoxidil wherever you are. Okay, good
Mm-hmm.
brand of your choice.
Mm-hmm.
Okay, and what's his age?
Mm-hmm. He's
Did you
35
mention?
years old.
Okay, if he's like unmarried, he can use finasteride. If he's married, no finasteride oral. Okay,
Mm-hmm.
and that will protect existing hair. Means instead of losing bald, I mean, like getting bald early, he may get bald gracefully. Okay, and
Mm-hmm.
after 30, it's age related, not genetic related. Okay,
Mm-hmm.
PRP, I do missionary acupuncture PRP, higher end version of PRP, where we
Okay.
inject platelets into the roots. Okay,
Mm-hmm.
not into the skin. Into the skin means painful, bleeding, headache. No, hair present below, like a hair, like a present, like nerves are present below the hair, not above the hair. And
Mm-hmm.
blood vessels also present below the hair, not above the hair. So if you go
Mm-hmm.
for PRP, there should be no oozing of blood like a pipe, or it's like
Mm-hmm.
painful like cutting with a knife. No, you should have like
Mm-hmm.
comfortable posture. We do acupuncture PRP, missionary one. Entire
Mm-hmm.
follicle, entire scalp will be addressed. It will take some time, but this is a worst posture. Start minoxidil. Depending upon marital status, you can go for finasteride under
Mm-hmm.
doctor observation and try PRP. How many sessions? Only 3 sessions. And
Mm-hmm.
once you notice some changes in your scalp, then go for the maintenance. We can't try PRP for 100 years and say it's no. You have to try only for one cycle, 3 to 4 months. Then if it's working out, then that's a very good sign for maintenance.
Mm-hmm.
Bald means bald. That's only transplantation.
Okay. Okay. So people say that if you have androgenic alopecia, you will ultimately go for surgery only, like
Yeah.
transplant.
Again, like androgenic alopecia, we can't guess their future.
Uh,
Okay. They may not get bald also. Once
mm-hmm.
genetic clock stops ticking, na, they won't get bald. Okay. We don't know when it stops. So our job is use the products, live over the results.
Mm-hmm. Okay, that's very interesting, doctor. So, doctor, would you like to give any take-home message or any other important tips for the hair, for healthy hair, or any suggestion to our viewers today?
Sure. So, like healthy hair, what shouldn't you do means don't use hard water.
Mm-hmm.
Don't apply hair oil to the scalp after head bath. Try to avoid pollution and passive smoking. Anybody smokes around you, stay away from them. And simple layman knowledge: one fruit, one vegetable, one dry fruits. And if
Mm-hmm.
you're getting bald, consult a dermatologist. Only dermatologist, not like dentist or a layman, okay, or beauty parlors. They are
Mm-hmm.
not your doctors. Okay. By the time you realize now, you'll be losing valuable time. And
Yeah.
PRPs, okay, PRPs, get it done only when professional clinics. Don't carry
Mm-hmm.
it away by all the things, marketing strategies. Don't carry it away. There are only a few things. Don't waste your time. If you're getting
Mm-hmm.
bald, consult a dermatologist.
Mm-hmm. So don't waste your time, don't waste your money, and get frustrated, and then
Yeah,
in the
that's
end, just break.
psychological. That's psychological thing. We stress a lot depending upon hair. Everybody wants the hair on the scalp.
Yeah, yeah. So it's always better to early intervention with the doctor always helps.
Yes, exactly.
Thank you so
Okay.
much, doctor. Thank you so
Welcome,
much
ma'am.
for
Welcome.
sharing all the expertise with us today and answering so many questions and all the questions of our viewers also. It was delight to have you and thank you so much for your valuable time.
Welcome, Ria. Most welcome. Bye.
And also thank you viewers for joining us today. And yes, I could not take all the questions, but yes, if doctor have some time next time, we will create more awareness on another topic on hair or skincare, and can take the rest of the questions in future. And see you again, doctor, and have a nice evening.
Yeah, most welcome. Thank you. Bye. Good night.
Thank you, doctor. Bye bye.